Okay. Sige. So let us continue, class, with our discussion about antihypertensive agents. We are done with our diuretics as well as our drugs that alter sympathetic nervous system function. That includes our alpha-2 receptor agonist. Ito yung mga alpha receptor agonist natin. And then our ganglion blocking agent. We actually have one. We have mecamylamine. Hindi ito kasali sa quiz ko. Adrenergic neuron blocking agents also. So this has something to do with the production of norepinephrine. They have different mechanisms of actions though. Please have a review on that. And we started with beta adrenoceptor blocking agents, or this is what we commonly call as beta blockers. Okay? So again, hindi ito kasali sa quiz. Ang isasali ko lang diuretics and yung first part of this slide. Ito, para hindi kayong mawala. This one, starting here until here. Makikita niyo may nakalagay diuretics kasi nakaloop ito sa diuretics ko na slide. So again, diuretics na slide, and then from the first part of this slide until here, sa potassium sparing diuretics. We will have a separate quiz from this one up to the last na i-discuss ko this morning. Asa na yan? Okay, again, we started our discussion with the beta blockers. Now, from the name itself, beta blockers, they are antagonists of the beta-1 receptors. So, meron tayong antagonist of the beta-1 receptors. However, there are available drugs in the market that are non-selective. So, when you say non-selective, they block the beta-1, but at the same time, they have the ability to block the beta-2. So one example of that is propranolol, which is actually the first drug discovered under the beta blockers. So aside from being a drug for heart failure or for patients with heart disease, this can also help in lowering the blood pressure of a hypertensive person. That is again due to their blocking activity to the beta-1 receptor that will result to the decrease in the heart rate, in the force of contraction, and that means there will be decrease in the cardiac output. So since the heart will not really pump a lot of blood, then the blood vessels will not really require a lot of force to have that blood flow all over the body. That means there will be a reduction in the needed pressure. Okay, so that's how the beta blockers help in the reduction of blood pressure. So the patient again will have a lowered blood pressure, but at the same time, the indicator or indicators that the propranolol is really effective is when the patient experiences resting bradycardia and even bradycardia after exercise. So I told you last time, our heart rate, normal heart rate is 60 to 100 beats per minute. And when a person takes beta blockers or beta blocker, then he or she may experience a heart rate which is lower than 60, and that is normal. Now, propranolol is easily metabolized and eliminated in the body, thus this is given twice a day. However, I think we ended here with the toxicities of propranolol. Syempre, we have bradycardia. The bradycardia is its effect, but it will become its toxicity if it becomes excessive. And there will be peripheral vascular insufficiency. So remember, there will be less cardiac output, and that will result to our blood vessels not really giving a lot of force for the blood to flow. And then masked hypoglycemia effect of oral hypoglycemic agents. We have identified some OHAs last meeting. The most common one is metformin. We have the other drugs like glimepiride, glibenclamide, glipizide, pioglitazone, rosiglitazone. Have a review on that and get to know these drugs as you have your internship. Itong mga drugs na ito, syempre, can lower the blood sugar level. And during excessive na effect, when you say excessive na effect, talagang bababa yung blood sugar ng patient na magre-result siya into hypoglycemia. So we have to monitor that. Now, I told you na we have signs and symptoms that the person experiences hypoglycemia. One of that is sweating, and then we also have palpitation. So there will be tachycardia for the patient again who experiences hypoglycemia. However, if the patient concomitantly takes a beta blocker while taking the oral hypoglycemic agent, then this drug, the beta blockers, can mask especially the palpitation. Kasi ang effect ni hypoglycemia, palpitation, tapos nag-inom kag beta blocker na magbaba ng heart rate. So the patient can no longer tell if nagha-hypoglycemia na ba siya or hindi. So therefore, if the patient has diabetes, it will be much more ang tawag dyan, efficient if we give him or her another antihypertensive drug if he or she is also hypertensive. But if in the case na wala na talaga tayong choice, kailangan din natin siyang bigyan ng beta blockers, all we need to do is to monitor the blood sugar level of the person kasi baka nasobrahan na siya ng kanyang gamot sa diabetes and magkakaroon ng hypoglycemia. Hindi natin makikita kasi nga namamask siya ng beta blockers. Now, aside from that, since propranolol class is non-selective, anong ibig sabihin nun? It can block the beta-1 receptors, but it can also antagonize the beta-2 receptors. Remember, beta-2 receptors are found in the lungs and our bronchioles. And once activated, it can cause bronchodilation. However, this time, this is blocker, ha? So, it will not be bronchodilation. It will be bronchoconstriction. So, if the patient class is given propranolol and at the same time he or she is asthmatic, then that will be a problem. So, do not forget in dispensing propranolol and other non-selective beta blockers to patient, you should know class whether he or she is suffering from asthma or even COPD. That's chronic obstructive pulmonary disease. Okay? Kasi this should not be given. I'm talking about propranolol, ha? Kasi meron tayong cardio-selective beta blockers. When it is considered as cardio-selective, this drug will only inhibit the beta-1. In some extent, it can inhibit the beta-2, pero the effect will be much lesser compared to the non-selective. So, pwede ito. Kung asthmatic ang patient natin and we are really compelled to give beta blockers to the patient, then please use the cardio-selective ones. Their affinity is more on the beta-1 receptor. So, I use this mnemonics in remembering the beta blockers that are cardio-selective. BAMA-ECB. BAMA-ECB. Minsan it's BIM. BIM lang. Hindi nila sinasali si ciprolol. Pero pwede din yun namang gamitin itong mnemonics neto. So we have betaxolol, atenolol, metoprolol, acebutolol, esmolol, ciprolol, and bisoprolol. Okay? The most common ones, syempre, we have the atenolol, and ito talaga ang pinaka-common as in the metoprolol, especially the neo-block mo po na siyang isa sa mga drugs na reseta sa silingan. So be careful of using that also. So ito na yung sinabi ko kanina. Both of them, metoprolol and atenolol, are the most widely used beta blockers in the treatment of hypertension. Again, their advantage is they are cardioselective. So they have high affinity to the beta-1 receptors compared to the beta-2. So we have again, metoprolol class, lopressor is our innovator drug. So ito talaga yung pinakauna, though hindi siya yung pinakasikat. Now, what is good about metoprolol is it is actually equipotent with that of propranolol, okay, in blocking our beta-1 receptor. So definitely their actions are equal. They have the same affinity to the beta-1 receptors. But again, this has an advantage of being a cardioselective agent. So ginagamit natin siya for both hypertension and for those patients with heart failure. Now, how about atenolol? Tenormin class is our innovator drug also. So again, when you say innovator drug, that's the first na brand in the market. They were the first one who made a drug that has atenolol as the active ingredient. Now, si atenolol naman is ginagamit siya once a day only. However, this is less effective compared to metoprolol. So when you say less effective, you're going to take atenolol, yung reduction in the blood pressure will not be the same with the metoprolol. Kung gusto mong malaking reduction talaga in the BP, you use the other one, the metoprolol. Anong difference ng prototype and innovator drugs? Innovator drugs, we are talking about the brand names there. Okay? Pag sinabing innovator drug, like sa paracetamol, paracetamol's innovator drug is Tylenol. So sila yung pinakaunang nag-produce ng paracetamol. Okay? So since sila yung pinakauna, they have actually, for a long period of time, they have the patent for paracetamol. Walang pwedeng mag-release na company ng other paracetamol kasi sila nga yung una. Kaya innovator drug yon. Pero when the patent expires, ayun na, naglabasan na yung lahat ng paracetamol in the market. Kaya ngayon, marami na tayo masyadong paracetamol. Pero pag sinabing prototype drug, yan yung first na na-discover for a pharmacologic class ng drugs. Example, beta blocker. Ang pinakaunang beta blocker na na-discover is si propranolol. Yun yung ibig sabihin ng prototype. Pinakaunang drug na na-discover under that class. Okay? Or kung example, loop diuretics. Ang pinakaunang na-discover na loop diuretic is the furosemide. So siya yung prototype. Okay? Again, the innovator drugs are those of the brands. Pinakaunang company na nag-produce ng gamot na yan. So they have the patent. I think most of the time it's 20 years. Pag ikaw yung pinakaunang nag-produce ng drug na yan, 20 years ang ibibigay sa inyo kasi syempre kailangan mong bawiin lahat ng nagastos mo, lahat ng effort mo. So for the whole 20 years, ikaw lang ang may karapatan mag-produce ng drug na yan. Pero when the patent expires, pwede na yung ibang companies class na mag-produce ng kanilang sariling brand with the same generic. Okay? Sige. Any question about our cardioselective agent? Alin dyan yung hindi naintindihan? Baka meron kayong gustong i-clarify. Wala. Okay. How about other drugs that are non-selective? So this is aside from the propranolol ha. So isalin niyo si propranolol dito. Okay? Sige. So yung mga kasama ni propranolol na non-selective beta blockers, they can also inhibit the beta 2 receptors. Therefore, please use this with caution sa mga patients with asthma or with COPD. So again, we have propranolol and then nadolol and cartilol. So syempre, these are their brand names. And then we also have class drugs that are considered beta blockers, pero they have somewhat partial agonist na activity. Okay? Kasi nalibog mo ha, ma'am, beta blocker man siya. So blocker siya, antagonist siya. Antagonist talaga siya, class. It can inhibit the beta 1 receptor. However, meron siyang partial na agonist na action. Okay? Partial lang. So, ano yun? Pindolol, acebutolol, and penbutolol. So, at some point, class, itong beta blocker na ito can also activate the receptor partially only. Okay? Partial lang. So, i-block niya, bababa yung heart rate, bababa yung force of contraction. But again, in some cases, there will be receptors that will be partially activated. Okay? So, do not use this for patients with, example, heart failure. Okay? We can use this though for patients with hypertension. Pero for heart failure kasi, hindi natin pwedeng pabilisin yung kanilang heart rate or hindi natin pwedeng yung sa heart rate mismo, if that is the case, hindi natin siya pwedeng gamitin. Kasi nga may partial agonistic action siya. Blocker, pero some lang ha, hindi naman totally. Kaya nga partial agonist lang. May mga some na receptors na ma-activate. And then, we also have mixed-acting beta blockers. Pag mixed-acting, they are beta blockers, but they can also block the alpha receptors, especially the alpha 1. So, ang activity nito, medyo dalawa, no? Dalawa. Bababa yung blood pressure ng patient due to the beta receptor blockade, and at the same time, bababa pa talaga yung blood pressure kasi na-inhibit din yung alpha receptor. Remember yung alpha 1 receptor, if we block that, can cause vasodilation. So, bababa din yung heart rate. So, ano yung mga mixed-acting beta blockers natin? Please take note of this. Sila yung mga hindi talaga nag-end sa ulol. That's how you remember them. Madali silang tandaan. Kasi, again, di ba, pag sinabing beta blockers, we have ending na olol. Ito, sila, hindi olol yung ending nila. We have the labetalol, carvedilol, and the nebivolol. Except for nebivolol though. But the two which are very common na mixed-acting beta blockers do not really end with olol. Ang pinaka-common sa kanila talaga si carvedilol. But yung correct na brand, I think this is not really the most commonly used brand. I think it's the Carvid. And we have 6.25 milligrams neto, no? Yung common na lower dose. Okay? And then 12.5 yung higher dose. So si labetalol and si carvedilol are actually good in treating hypertensive emergencies and even heart failure. Kasi dalawa yung action niya. Inhibition of the beta 1 receptor and at the same time the alpha 1. Actually, labetalol is used in treating hypertension sa patients natin with pheochromocytoma. Remember the pheochromocytoma, that's the condition wherein there is a tumor in the adrenal medulla. And this tumor releases a lot of norepinephrine and epinephrine, leading to an increase in the blood pressure. There is overwhelming amount of these two substances, NE and epi, and syempre they can activate beta-1 receptors and thus causing increase in the blood pressure. So there is hypertension for people with pheochromocytoma. And at the same time, labetalol is used for hypertensive emergencies. Okay, masyadong mataas na blood pressure. Now, aside from that, please take note also, di ba our drug of choice for hypertension on pregnant women is our methyldopa or our aldomet. So this is the second one. The second drug for patients who are pregnant and at the same time merong hypertension. And then carvedilol is mostly used for heart failure and at the same time hypertension. So makikita nyo ito, a lot of this is used in the community, especially most of these patients, kung hindi yan sila hypertensive talaga, they have heart conditions. They have heart failure. Again, our starting dose for our carvedilol is 6.25 milligrams. That's BID. So that's twice a day. Okay? And lastly, we have the nebivolol. Now, itong nebivolol is not really directly on the alpha receptor, but it has also vasodilating activity. But in this case, it's because of the release of intrinsic na nitric oxide. So our body is capable of producing this substance, nitric oxide, in our blood vessels, and we have a lot of if we have a lot of nitric oxide in our body class, that will result in the relaxation of the blood vessels. In short, there is vasodilation. So dalawa pa rin yung kanyang activity, beta blocker siya, but at the same time merong vasodilating activity. And lastly, before we'll move on to the alpha-1 receptors, we have the esmolol. Now, from the name itself, esmolol, please connect this. though ano rin siya ha, kanang sa English pa, mali man talaga, hindi siya yung proper term. Pero, ano na lang, i-connect nyo siya sa word na small. Ang proper term talaga is short. Pero kasi si esmolol among the beta blockers has the shortest half-life. Actually, after 9 to 10 minutes, half of the drug is being eliminated. That's how fast the esmolol will be eliminated in the body. Therefore, ginagamit lang si esmolol via constant intravenous infusion. Kasi nga mabilis siyang ma-excrete. So parang binibigay siya like our fluid replacement therapy na constant yung IV infusion. Ganun siya ginagamit. So where do we use our esmolol? Pwede siyang in the management of intraoperative and post-operative hypertension. So intra during surgical operation or after surgical operation wherein the patient experiences hypertension, that's the time we use esmolol. Okay? And we can also use this for hypertensive emergencies since this is given intravenously. Okay? Para bumaba kaagad ang blood pressure ng person experiencing hypertensive emergency. Especially if that is accompanied by increased heart rate or tachycardia. Now, another board exam question is that esmolol class is also our drug of choice for caffeine toxicity, okay, or caffeine poisoning. That's our esmolol. So remember, diba, if you drink a lot of caffeine, if you take a lot of caffeine, what are you going to experience? Palpitation. There will be tachycardia. card. Yan. Since this can lower the heart rate, syempre beta blocker siya. So, ayan yung ating drug of choice for the poisoning. Okay? Any question about our beta blockers? Wala. Sure. Sure na yun na. Kasi pagkawan, mag-quiz ko na. By the way, I hope you have book also sa pharmacology. Doesn't matter what book are you going to read. You can borrow from the higher batches. They have books actually. We can go to the library and borrow books. Please read a lot about these drugs kasi sinasummarize ko lang ito. Okay? Especially if you will be working in the community, you need references there. Kasi mahirap i-memorize class kung how many times a day are you going to take these medicines. So, kung hindi kayo sigurado, please always go back to references. What I'm using right now is the cat zone. I don't have my Lippincott here. I think it was borrowed long time ago and it was not really returned. So I have no choice but to read the cat zone. So if you have cat zone also there, please try to read cat zone. Okay, and if you have questions na baka may part kayo sa libro na hindi niyo maintindihan, you can ask me. Okay? Sige. Let's continue with nagtapad na jud ko diri green no ba. Kay basig sobrang ta maabtan tag alas 10. Okay. We have alpha-1 blockers. Okay? From the name itself, alpha-1, our target, syempre, is the alpha receptor. Where can we mostly find our alpha receptors? Saan yung major location niya? I hope by now, master niyo na yan, hindi niyo na talaga siya makalimutan. Very good. Blood vessels. We can find our alpha-1 receptors in the blood vessels. Now, if we are going to activate this receptor, what will happen to the blood vessels? Anong mangyayari kung i-activate ang receptors na ito? Anong mangyayari sa blood vessels? Very good. There will be constriction. Okay? Vasoconstriction. And vasoconstriction means there is increase in the blood pressure. Therefore, we are going to block that. If we are talking about antihypertensive drug, we can block the alpha receptor. So sa hypertension class, maraming involved class na parts ng body, maraming involved na receptors. So di ba we started with the diuretics na yung action is on the kidneys. Okay? And then we have the drugs that alter sympathetic functions like directly to the neurons. And then meron tayong beta blockers. Meron tayong alpha-2 agonist, yung mga centrally acting sympathoplegics natin like clonidine and methyl-dopa. So that is the reason marami tayong masyadong anti-hypertensive agents kasi maraming nag-govern sa blood pressure natin in our body. So again, one of that is the alpha receptor. We need to block this since activation of this can cause increase in the blood pressure due to vasoconstriction. So in your People 1, you learned about this. This is not really new sa inyo. Itong mga alpha-1 blockers, those are the drugs that end with zosine. Okay? Kung ang beta blockers end with olol, ito naman nag-end sa zosine. Okay? So we have doxazosine, prazosine, and terazosine. Do not forget their brand names, ha? Kasi minsan sa quiz, brand names yung nilalagay ko. Especially if that is the innovator drug. Okay? So again, mechanism of action is just the blockade of the alpha-1 receptors leading to Prevention of the sympathetic vasoconstriction. So there will be relaxation of the blood vessels. So walang vasoconstriction na mangyayari. But at the same time, alpha-1 receptors can also be found in the prostate of our males. Okay? Now, if we are going to activate the alpha receptors in the prostate ng mga lalaki, that will actually result to the contraction of their prostate. So, mahirap yan in the case of patients having benign prostatic hyperplasia. Yung dadami yung number of cells in their prostate, so it will be larger compared to the normal size. Okay? So, ito, pag iba-block natin yung alpha-1 receptor na nasa prostate nga ng mga lalaki, syempre wala tayong prostate mga babae. So, sa mga lalaki ito, this will cause the relaxation of the smooth muscle. So, yan yung ibig sabihin ng reduced prostatic smooth muscle tone. Magre-relax siya. Hindi siya gaanong magpo-contract. Okay? And then, alpha blockers are more effective when used in combination with other agents like our beta blockers and at the same time diuretics. So kaya aside sa marami tayong antihypertensive agents in the market, we also have a lot of combination drugs. By the way, class, we don't combine drugs that have the same mechanism of action, ha? Again, we don't combine drugs that have the same mechanism of action. Ang tawag dyan, pag kinumbine mo ang drug na the same ang mechanism of action is duplication. We don't do that in pharmacy. Kasi it has no really like, yung additional na effect, wala. Kasi parehas lang naman sila ng receptor, parehas sila ng mechanism of action. So please bear in mind that if we are going to combine drugs, the two or whatever, kung marami ba silang i-combine mo, should have different mechanism of action. So just like our alpha-1 blockers, if we're going to combine it with beta blockers, there will be an interaction, a much more larger effect na makukuha natin. Or if we combine it with diuretics, makukuha din natin yung mas malaking effect sa kanila. So, mas malaki yung ibababa ng blood pressure. Okay? So, clinical applications, aside from using this for hypertension, ginagamit din natin sila for BPH. Actually, their use have been shifted to BPH nowadays. We don't really give them to people with hypertension, but most of the time, it's on the patients with BPH. So, ito yung adverse effects. Actually, na-mention ko na to sa inyo last time. Our zosins can cause first dose syncope. So, during their really first dose, after diagnosis, they will be given these drugs, and the first nila na pag-administer ng drug, syempre that's the first dose, they will experience the syncope or the first dose phenomenon. Parehas lang yun sila. Na mangyayari sa patient, there will be a drastic drop in the blood pressure that can even result to fainting. Kasi mag-hypotension yung patient. So what are we going to do? In order for us to avoid first dose syncope, you have the options whether to give the first dose at bedtime. Okay, at bedtime kasi patulog na yung patient natin, and walang accident na mangyayari in case of like fainting. Okay? Or we can taper the dose, meaning we can start with a lowered dose. Okay? Hatiin muna natin ang dose before gradually increasing it. That's how we avoid the first dose syncope. And this one is also associated with orthostatic hypotension. So mababa masyado na blood pressure. And then orthostatic has something to do with the position. So ito yung may experience natin na from a supine position, like nakahiga ka, tapos bigla kang tatayo. Kasi magbabago kasi yung blood pressure natin dyan. And if our body cannot react immediately, there will be a drastic drop also in the blood pressure during the change in the position na leading to fainting. Kasi magbababa again yung blood pressure. Okay? And then other alpha adrenoceptor blocking agents. Itong mga zosins natin class ha, are selective sa alpha-1 receptor. Itong dalawa, phentolamine and phenoxybenzamine, are actually non-selective. So they can block the alpha-1, but at the same time, they can block the alpha-2 receptors. So when are we going to use the phentolamine and the phenoxybenzamine? Ito silang dalawa ginagamit natin for the treatment, diagnosis at the same time treatment of pheochromocytoma. So na-mention ko na kanina what pheochromocytoma is. Okay? But phenoxybenzamine has a longer duration of action compared to phentolamine. So yan yung kanilang difference. Okay, questions about our alpha receptor blockers. Zosins ha, alpha-1 blocker lang yan sila. Pag itong dalawang P, phentolamine and phenoxybenzamine, they are non-selective. So, we have a lot of drugs class na may mga affinity sila sa maraming receptors. So, yung target talaga na receptors that will become their effect, which is called the pharmacologic activity, and their binding to other receptors, yun yung mag-e-explain ng kanilang side effects. So, kaya nga siya tinawag na side effect kasi meron ka talagang major effect na target receptors. However, these drugs can bind to other receptors. Magkukos din sila ng effect dito. So, side effect. Okay? Yan yung tinatawag na side effect. Side effect is different from adverse effect. So, side effect class has something to do with the pharmacodynamics. Meaning yung effect ng drug sa body, yung receptor kung saan sila magbabind, yun yung side effect. Pero if the effect class has nothing to do with these receptors, ayun yung tinatawag na adverse effect na basta iinom ka, magkakaroon siya ng hindi kaaya-ayang effect, tapos hindi mo siya ma-explain sa mga bindings sa receptors inside the body, adverse effects yung tawag dyan. Okay, yun yung kaibahan. So do not call all the side effects as adverse effects kasi magkaiba yan silang dalawa. Okay? Walay questions? Sure na good morning inyong walay pangutana. Sure na good na siya. Okay, if wala, we have the vasodilator. So from the name itself, vasodilators. Ito class, they will directly dilate the blood vessels. So they have nothing to do with the alpha-1 receptors. Kasi alpha-1 receptors can cause like vasoconstriction. Pag block, mag-cause siya of vasodilation. Ito, the effect will be directly on the smooth muscle of the blood vessel. So we can also call them direct vasodilators. Now we classify them into two, oral and parenteral. Siyempre pag oral, no? Oral, binibigay natin orally. Ito yung ginagamit natin as maintenance drug. Okay, so long-term outpatient therapy for hypertension. Anong examples natin? We have the minoxidil and hydralazine. And yung parenteral, syempre we don't give it as maintenance drug, but we reserve this in case of emergency. So ano yun? We have the nitroprusside, diazoxide, and phenol-dopam. So I'm not just sure if you are familiar with these drugs, but I think the group of Charles is very familiar with the minoxidil. Okay? And aside from these drugs, the oral and the parenteral vasodilators, the CCBs are also included here sa mga vasodilators natin. Calcium channel blockers. I'll explain that later. and also the nitrates. Our nitrates are also considered as direct vasodilators, but they are not really used for hypertension. Instead, we use them mainly for angina. So again, angina is chest pain. We will have a separate chapter for that. Okay? So let's identify the mechanisms of actions of these vasodilators. So number one, we have here drugs like nitroprusside, which is given parenterally. And then we have hydralazine. Again, we have hydralazine, which is orally given. And then we have nitrates. Yung nitrates, marami itong dosage form. May patch, may orally given, syempre may IV din. And please take note, itong dalawa, histamine and acetylcholine. Syempre, histamine is not a drug. It's an endogenous local mediator in the body. These two, isalin na lang natin sila kasi magkapareho yung kanilang activity in the body. They cause class release of nitric oxide. Either from the drug itself, like the drug will be metabolized and then pag ma-metabolize na siya, mag-release siya ng nitric oxide. So dadami yung nitric oxide in the body. Or pwede din itong mga drugs na ito will trigger our endothelium, our blood vessels to release its own nitric oxide. Okay, so pag dumami ang nitric oxide class, itong drug na ito automatically dilates the blood vessel. I mean the substance nitric oxide, it will automatically dilate the blood vessel. So kaya tinawag itong direct vasodilator. Okay? So kaya yung histamine class, di ba may tinatawag tayong anaphylactic shock? That's the severe form of allergy wherein the patient will experience bronchoconstriction. So mahihirapan siyang huminga. And at the same time, the patient will experience shock. Shock itself. When you say shock, there will be a sudden drop in the blood pressure. So ito na yung mag-explain ng shock ngayon sa anaphylactic shock. Histamine can cause release of nitric oxide, which is a direct vasodilator na substance. So syempre pag nag-dilate, there will be a decrease in the blood pressure. Okay, now how about calcium channel blockers? From the name itself, calcium channel blocker, they will block the entrance of calcium in the cells, especially the blood vessels. Now remember class, our blood vessel is a smooth muscle. Take note of the word muscle. It's a muscle, therefore it can contract, it can relax. And one way to contract these muscles, diba, is through the help of calcium. You know that in your anatomy and physiology. Kailangan natin ng calcium before mag-contract ang muscle. It's not just about potassium. We also need calcium class, especially for the myosin and the actin. If you can still remember your anatomy and physiology, these two muscle fibers class will interact with each other, but they will just interact if there is the presence of calcium. Pag meron ng calcium, mag-interact sila and contraction begins. Now, if we are going to contract the blood vessel, that will lead to constriction. Okay? Contraction means constriction. Kasi pag nag-contract yung muscle, liliit yung dadaanan ng blood. Okay? So do not forget that contraction of the blood vessel means constriction. Therefore, we can inhibit the calcium channel para malilimit yung entrance ng calcium in the cell. And syempre, walang contraction na mangyayari. So there will be no constriction. That's how the calcium channel blockers help in the treatment of hypertension. Marireduce yung calcium influx. Okay? And then, we have minoxidil and diazoxide. Their action naman is on the potassium channel. Give me a second, I'll just get my pen. I want to draw this so that you will understand what happened during the hyperpolarization. Ha? Okay, let's continue. So for minoxidil and diazoxide, their action is on the hyperpolarization of the muscle. What happened? Their action is more on the potassium channel. So ganito. If this is the cell, or hindi siya ma-argue. Nangyari. Ba na niya akong pen? Sige. The last is uli na sad. So, bisog kaayo ang ano. Ang online, tapos mag-school. Sige ko uli dala sa ako ang mga gamit. Okay, ayan na siya. Anyway, if this is the cell class, okay, we have the so-called sodium-potassium channel here, wherein mag-exchange si potassium and si sodium. Okay, again, there will be exchange of sodium and potassium. Remember our mnemonics na piso? Can you still remember this? Potassium in, sodium out. Our ions class position in the body is when you say potassium, it should be found inside the cell. So intracellular siya. And then ito, sodium out, extracellular. So dapat nasa labas. So dito yan sila mag-exchange. For example, si potassium ay nasa labas, si sodium nasa loob. So mag-exchange yan sila. Now, yung exchange ng sodium and the potassium, yung kanilang ratio is 3:2. 3 na sodium ang lalabas, okay? And then, 2 potassium ang mag-go inside. So, for you to remember this, you can use the mnemonics si 3 na antukin. Okay? Again, para hindi nyo makalimutan na kapag nag-exchange si sodium and si potassium sa cell, ito yung mnemonics na ginagamit natin, si 3 na antukin. Okay? So, 3 na sodium ang lalabas, 2 potassium ang papasok. So, if the patient class takes either minoxidil or diazoxide, potassium channels will actually be open. Okay? So, ma-open ito leading to the entrance of potassium inside the cell. And then again, in every potassium na lalabas, baliktad, every 2 potassium na papasok, merong 3 sodium na lalabas. So, hindi pantay yung, yung number. And that will actually decrease class the, anong tawag dyan? Yung charge ng loob ng cell, meaning magiging more negative ito. Though positive ions yung yung involved, kaya lang hindi kasi pantay. 3 sodium ang lumabas, 2 lang yung potassium na papasok. Magma-minus yung charge inside the cell. So, di ba remember pag sinabi kong naging more negative itong loob ng cell, ang tawag dyan, hyperpolarization. And that will lead to the decrease in its function. So in the case class of muscle, pag nag-decrease yung energy dyan inside, magiging more negative siya kasi mas daming sodium ang lumabas kaysa sa potassium na pumasok, magre-relax yung muscle. Hindi, magde-decrease yung kanyang function. So yun yung way of the minoxidil and diazoxide to decrease the blood pressure. As the muscle relaxes, meaning nun, there is vasodilation. Okay? So pag nag-dilate, syempre, there will be a decrease in the blood pressure. Okay? Questions about that? Alin part doon ang hindi naintindihan? I hope naintindihan yun ha. Kahit online yung class natin and it's very early, I hope namatay yung mga utok din ha to listen para alam nyo talaga kung anong nangyayari sa body if we are going to take these drugs. And we can explain how these drugs help a person with hypertension. Okay, last for our vasodilators, we have the phenoldopam. From the name itself, plus phenoldopam, please take note na its action is on the dopamine receptors. So it's different from all the other drugs. We don't really discuss dopamine that much, but this drug activates the dopamine receptors, and these dopamine receptors class can in turn cause dilation of the blood vessel. So may series of activity yan sa body na pag na-activate si dopamine, may mga other substances pa and receptors na ma-activate. Ang endpoint is the dilation. Okay, so there will be dilation of the blood vessels. Kaya nga siya tinawag na vasodilator. And that's how it helps a person with hypertension. Now we can discuss them one by one, starting with hydralazine. Take note, hydralazine is given orally. Yung mechanism of action niya, release of the nitric oxide, in which nitric oxide is a direct vasodilator. Direct niyang idadilate yung blood vessel. But take note, anong blood vessel yun? It will dilate the arterioles but not the veins. Remember, iba yung activity ng ating arteries, iba din ang veins. Ano nga yung pagkakaiba nila? Yung arteries and veins natin, mga blood vessels natin. What's the difference? Anong kinakarry ng arteries? Siyempre blood. Anong klaseng blood? Very good. Arteries carry oxygenated blood. So that's coming from the heart, going to the body to distribute oxygen. Now, if all the oxygen has been used up, then the blood will return to the heart. So the veins class carry deoxygenated blood. Okay? The oxygenated blood have for the veins. But for hydralazine, this is a vasodilator due to the release of nitric oxide, but only the arteries can be dilated, but not the veins. So how do we use this hydralazine? Most often, we combine this with the nitrates. The nitrates are the examples ng nitrates natin. We have syempre the nitroglycerin. We have nitroglycerin patch, and then we also have ISMN and ISBN. I don't know if you're familiar with them. ISMN is isosorbide mononitrate. Ano brand name yan? Isordyl. Isordyl is ISBN, isosorbide dinitrate. Ano nga ang brand name ng ISMN? Kalimutan ko tuloy. Isordyl, isakit, whatever. I'll try to remember the brand name of the ISMN. Pero you can encounter them even in the hospital or even in the butika, community pharmacy. All of them are nitrates. Considered as nitrates, and we use them for angina. But for patients with heart failure, we combine the nitrates with hydralazine. Okay? Yeah, thank you. It's Monokit. And what's the other one? Meron pa talagang common na brand name. Yeah, the Indoor. Thank you. Yan yung gusto kong maalala. The Indoor is the ISMN. Isosorbide mononitrate. ISDN is isosorbide dinitrate. So we have the Isordil. I believe you're familiar with Isordil. Kapit magbilang ani gamay kaayo nga tablet given sublingually. So again, we use them for angina, for chest pain. Yeah, it's color pink and it's very small. So definitely it's very cute. And it's under the loose tubs. So therefore, if you're going to dispense this, you really have to be careful in transferring it to another container. Okay? Sige. Na toxicities for our hydralazine. Toxicities. So this is the reason why pharmacists don't really like taking drugs. Okay? Isa kabuok nga drug. Isa lang iyang activity para sa hypertension. Or pwede duha for heart failure. Pero mas daghan kay ang list of toxicities compared to the list of application. Yeah, the imdorduros. Yan yun. Mga nitrates natin yan. So we have headache, nausea. Ito mga headache, nausea, and vomiting, do not give me this ha. Again, inuulit-ulit ko talaga, most of the drugs cause nausea and vomiting as a form of toxicity, except for anti-emetic. Kasi nga anti-suka siya. Or the rest can cause vomiting. Nausea and headache, they are very common. So aside from that, we have anorexia. The patient don't really want to eat if the patient is taking hydralazine. Palpitation, this is due to the decrease in the blood pressure. There will be reflex tachycardia. Pag mag-drop class yung blood pressure, magre-react kasi yung body natin. So nag-drop ang blood pressure, syempre pag react niya, gusto niyang ipataas ulit. So ang gagawin ng body natin is ipapabilis yung heart rate. Kaya most of the time, if our drug is to decrease the blood pressure, isa sa toxic effect nila or sa like adverse effect is the tachycardia, reflex tachycardia. Bibilis yung heart rate in an attempt to counter the sudden drop in the blood pressure. Okay? Our problem is that during the reflex tachycardia, since there is increased heart rate, this may provoke angina or ischemic arrhythmia. Okay, we'll have a separate discussion of arrhythmia and angina in the succeeding na mga chapters. Okay, there will be sweating, flushing, and take note yung na-bold ko dito kasi ito talaga yung favorite board exam question nila about hydralazine. Hydralazine can cause lupus-like syndrome. Okay? And lupus, systemic lupus erythematosus, the lupus itself. Diba? This is an autoimmune disease wherein, syempre pag autoimmune, the body can no longer identify what is self and non-self. So your immune system will be attacking your own organs. Okay? That's the problem with lupus. And yung one sign of having a lupus is yung malar rash or yung butterfly rash. Example, sa mukha, parang siyang butterfly shape na rashes. Again, that's one sign of the lupus. However, for hydralazine, it's just lupus-like syndrome. Wala naman talagang lupus ang patient. Pero magkakaroon kasi siya ng signs and symptoms that resemble lupus. So, kaya lupus-like syndrome ang tawag. So, isa na nun yung rash, yung malar rash, yung arthralgia, yung masasakit yung joints kasi nga that is being attacked by the immune system. Okay? And problems in the kidneys, for example. So parang lupus talaga siya, pero hindi naman talaga lupus. And then we have peripheral neuropathy like tingling sensations in the fingers, parang tinutusok-tusok ng karayom. That's peripheral neuropathy. and drug fever. Okay? Take note, class, we really have drugs that can cause fever. We call that drug fever. Atropine is one. Atropine, when given especially to children, can cause fever sa kanila. So again, we call that drug fever. Okay? And then this one, the hydralazine, can also cause one. Okay? And then the minoxidil. This is another orally taken vasodilator, but this time its effect is on the hyperpolarization of the muscle membrane, and that is due to the opening of the potassium channel. Okay? So pag maraming potassium, hyperpolarization ang labas. Pag na ay hyperpolarization, it means the inside of the cell is more negative, leading to the depression of its function. So pag na-depress yung function ng cell, hindi siya masyadong magpo-contract. Yun yung way ng pag-dilate ni minoxidil. But just like our hydralazine, arteries will only be dilated and not including the veins. Okay? Now, if hydralazine is used with diuretics or nitrates, this time naman minoxidil should be used in combination with beta blocker, or in this case, it's specific loop diuretics. Okay? Kasi yung mga vasodilators natin, class, hindi sila magiging effective most of the time pag single drug sila. Kasi nga yung activity nila is vasodilation. Tapos pag nag-dilate, magdadrop yung BP. And then meron kasi tayong other compensatory mechanism in the body. Pag nag-drop yung BP natin due to the vasodilation, magre-react yung body natin. I-attempt niya yan na itaas yung blood pressure ulit. Ganun yung body natin. Kung anong kulang, syempre, magkakaroon talaga ng feedback yan. Magkakaroon ng reaction. So, ganun yung mangyayari with our vasodilators. Pag dilate, bumaba yung blood pressure, ang body natin magre-react, i-attempt niya na i-increase yan. So, remember, marami tayong parts in the body involved in the regulation of our blood pressure. So, isa dyan yung heart, kaya magkakaroon ng reflex tachycardia. Papapabilisin ng body natin yung heart rate in an attempt again to increase the blood pressure. Okay, kasi there is sudden drop due to the vasodilation. And at the same time, the body will react, no, magbababa yung blood pressure natin, magre-react yung ating kidneys, class. There will be retention of the salt in the water that is again due to the attempt in increasing again the blood pressure. So that will be the reason why most of our vasodilators are combined with either beta blockers or the diuretics. First, to inhibit the increase in the heart rate, and second, to inhibit the water and salt retention. Okay? Now, toxicities. I don't care with the other toxicities na kasi we have these toxicities na very common with all the other drugs. Except for this one, tachycardia, palpitation, angina, and edema. Ito, body's compensatory mechanism kasi ito pag gumamit tayo ng vasodilator, yung reaction ng body. So kaya 'di ba sabi ko, isasabay siya sa beta blockers or sa diuretics. So pag kulang yung dose ng dalawang drugs na ito, talagang mag-experience ang patient nito. Tachycardia or palpitation, and due to the increased heart rate, there will be angina, there will be chest pain. And since there is water and salt retention, mag-edema ang patient. But board exam question talaga for minoxidil is this one. Minoxidil can cause hypertrichosis, or that is what we call hirsutism, meaning there will be increase in hair growth sa body, especially sa female. That will be bothersome para sa mga babae if you're going to experience hirsutism or hypertrichosis. Mapuno kag balahibo ani class. However, supposedly this is the toxic effect now of minoxidil. It can trigger growth of hair in the body. But nowadays, we don't really use minoxidil as anti-hypertensive drug. Instead, yung kanyang parang side effect or yung kanyang toxicity has become its major activity now. So you can see minoxidil in the market, pero yung activity niya is for hair growth. So kaya sabi ko kanina, the group of Charles knows this best since they use this as their positive control for their thesis. Okay, so you will be like this if you have hirsutism or you have hypertrichosis. So especially for female class, this will be very bothersome. So be careful also of using yung shampoo containing minoxidil. So baka manipis yung buhok ninyo and gusto niyo dumami yung buhok and then gumamit kayo ng minoxidil. Careful lang din, especially if it will have interaction with your face. So hindi man yan siya maiwasan pag nag-shampoo kayo. Pero you have to be careful ha. Kasi aside from the hair will grow sa inyong ulo, inyong nawong class, again, pag there will be interaction with the minoxidil, mapuno po na siya o buhok, just like this one. Okay? Sige, questions so far? Hindi pala siya matatapos, but we will have a quiz on Wednesday next week. About sa matapos ko lang. Until Monday. Wala na? Sige. So how about sodium nitroprusside? So sodium nitroprusside is given intravenously. Actually, this is a very powerful vasodilator. Bakit? Bakit siya powerful vasodilator among our vasodilators? Kasi, di ba, unlike the two na nauna nating i-discuss, it can dilate both arteries and veins. Kanina arteries lang yun, hydralazine and minoxidil. This time talagang kasama ang veins. That makes it powerful. Now, since this is given parenterally, we don't give this as maintenance drug, but this is class A reserve drug during emergency cases, hypertensive emergencies, and heart failure. Okay? IV infusion ito ha. And another thing that you need to know, this is a board exam question. Sodium nitroprusside, example in hospitals, are always freshly prepared. So before administration, that's the time ipe-prepare siya. Bakit? Kasi sodium nitroprusside is very sensitive to light. Okay, again, sodium nitroprusside is very sensitive sa light. So, madali siyang masira. So, ipe-prepare siya right before administration and it will be covered with foil. Okay? Toxicity of our sodium nitroprusside, syempre, excessive hypotension that may also lead to shock. Okay? The patient will experience shock. Tanan vital signs, baba. Especially the blood pressure. Remember, all will be dilated, arteries and veins. And take note that since this is a nitroprusside, we have here a cyanide in its structure. You're going to look at the structure of sodium nitroprusside. It really contains cyanide. So excess of this can really cause cyanide poisoning. So let us be careful also of using this. Remember, cyanide is a poison. It will cause inhibition of the cellular respiration. Papalitan yung mga hemoglobin natin, hindi na siya makakarry ng oxygen. And that's how we die sa cyanide poisoning. Okay? And then we have diazoxide, which is also given IV. Kaya intravenously. Kaya yung kanyang brand name is Hyperstat IV. Okay? So, how about this drug? Unlike the sodium nitroprusside, this is also only an arteriolar dilator. So it is given parenterally, IV siya, pero ang kaya niya lang i-dilate are the arteries, just like the minoxidil and hydralazine. Now, this is also reserved for hypertensive emergencies since this is given parenterally. Now, what's the favorite board exam question about our diazoxide class? Its structure is similar to our thiazide diuretics. Example, our hydrochlorothiazide. You can identify easily the hydrochlorothiazide, no? Kay, syempre na thiazide sa iyang name. Ang uban nag-end sa talidone. But nevertheless, they are diuretics, so they can cause urination, increase in the urine volume, and also sodium excretion. But even though they have similar structure with that of the thiazide diuretics, itong diazoxide can only dilate the blood vessels, but it has no diuretic activity. This is the favorite board exam question about our diazoxide. And toxicity, syempre, most of the time, their toxicities are just extensions of their pharmacologic activity. Pag masobrahan kayo, you will really suffer from hypotension. And this can provoke stroke, myocardial infarction, and angina. That is due to the body's reaction in the sudden drop in the blood pressure. It will increase the heart rate, remember? And that can trigger myocardial infarction, stroke, and even angina. And then at the same time, since this one has the same structure with the thiazide diuretics, this has the ability to inhibit insulin release from the pancreas. Okay? So, leading to hyperglycemia. If you are going to read again our slide sa thiazide diuretics, makikita nyo doon, the thiazide diuretics can cause hyperglycemia. Tataas yung blood sugar. So, ang reason yan again is kaya kasi nilang pigilan yung drug mismo, kaya nilang pigilan yung beta cells in the pancreas na mag-release ng insulin. So remember, insulin regulates the blood sugar level. So kaya may hyperglycemia. So itong si diazoxide, ginagamit siya for insulinoma. May mga patients tayo class na excessive yung release nila ng insulin from their pancreas. We call that insulinoma. And syempre, since marami sila masyadong insulin class, they experience hypoglycemia. So the toxicity can actually become an activity, a clinical application. So that's for the case of diazoxide. And let me just end here with phenol-dopam. Phenol-dopam, from the name itself, dopam, the activity is on the dopamine receptor. This is still given parenterally, and just like the diazoxide, this can only dilate the arteries. Okay, so again, pwede siya sa hypertensive emergencies or during post-operative hypertension. The activity agonist in the dopamine receptor, resulting in the dilation of the arteries only, and at the same time, it has a natriuretic activity, meaning it can excrete the sodium via the urine. Now, since this can cause sudden drop in the blood pressure, automatic class, may toxicity talaga yan siyang reflex tachycardia. Okay? And there will be headache. Plus, bakit may mga headache? If napansin niyo yung mga vasodilators natin, parang silang lahat meron silang toxicity na headache. Bakit? Kasi nga, nagkakause ito ng vasodilation all over the body. And sa ulo natin, class, if there is vasodilation, syempre magdadilate yung blood vessels natin, mas-stretch yung pain receptors natin sa ulo natin, causing headache. That is the reason why pag masakit yung ulo natin, it means na there is vasodilation. There is dilation in our blood vessels sa ulo. Pag nag-dilate siya, yung pain receptors natin, example sa skin, sa ulo, mas-stretch. Kaya masakit. Okay? And then there will be flushing, mamumula ang patient na encounter din natin to kanina sa isang drug, ang flushing. Syempre pag nag-dilate class, yung blood vessels, syempre lalapit yan sa skin kaya mamumula talaga. And then there will be a feeling of warm, mainit. Okay? And then there is increased intraocular pressure. Okay? Ito yung mga activities ng ating phenoldiphang. I'd like to end here. And then next week, Monday, I will continue with my discussion on calcium channel blockers. Konti na lang ito. Calcium channel blockers. After the calcium channel blockers, matatapos ko na itong antihypertensive agents. Konti na lang kasi yung mga drugs na may activity on the angiotensin receptor.